Welcome to this talk on reducing cardiometabolic risk. I'm so excited about this topic because in terms of cardiovascular health, this is the one area where prevention is incredibly powerful, and whereby people can, extend their lives by, you know, a couple of decades really by doing some simple things. And also, not just your quantity of time in terms of lifespan, but health span as well. So, cardiovascular disease is in most cases only diagnosed after a first event, when some kind of event has already occurred. And I see this in a number of my patients who have genetic risks. They'll go along, to their doctor and say, I'm really worried about arterial health. And I've asked for things like a carotid scan to be told we have to wait for a first incident before you're eligible for a carotid scan, which is just, incredibly sad because um, so much of cardiovascular and metabolic risk can be prevented if we know early on. And so, I'm going to encourage people to really start in their 40s to do, some investigations, get an idea of where they're at, and if there is an issue, to actively and proactively, address it. So, cardiovascular disease is the cause of nearly 30% of deaths in Scotland. And again, most of those could have been prevented, with early intervention, with prevention. And then there's the case, of course, where, an incident isn't fatal, but life-altering, such as when people have a stroke. Quality of life can be hugely impeded. So I think it's an area that's really worthwhile being proactive in. Cardiovascular disease is also the leading driver of causing age-related cognitive decline because your vascular system directly impacts on brain health and on so many organ systems. So being proactive in looking at what your risk is, looking at exactly where you need to put your energy and attention can be really useful. So especially if there is a family history as well. And again, keeping your vascular system healthy can add decades to your life.
Cholesterol has been villainized throughout the years as being the cause of cardiovascular disease. Yet, as cholesterol levels are being pushed lower and lower with the use of statins, we find that death from cardiovascular disease has not actually reduced. So, cholesterol is a really important building block for your stress hormones, your sex hormones as well. And an increase in cholesterol is the body's way of adapting to its environment. If the body is inflamed or stressed, the body will naturally increase cholesterol levels. So it makes sense then, rather than trying to just push down the cholesterol, dealing with the underlying drivers is more effective. And statistics show that 40% of people with heart attacks had a cholesterol level below 5, which is considered optimal. And cholesterol lowering medications do bring your cholesterol levels down on paper, so you will always see those levels coming down, but we know that they don't actually have a big impact on preventing heart attacks. So I think what we tend to find is that statins are thought to reduce the risk of death by only 30%. That means 70% of people on statins are still at risk for having an event. And that's because the underlying factors that are driving a big process are not dealt with. And we know that a lot of people also struggle with the side effects of statins. We know body pains, liver damage, gut and brain complaints. Keeping in mind that the brain is made up, 70% of the brain is made up of fat. So when you drive those cholesterol levels down, the impact on the brain is also quite significant. And moreover, statins increase the risk of postmenopausal women developing diabetes, which ironically increases the risk for cardiovascular disease. So I think the really important thing here is there is a place for statins, and they become really important in cases where people have dealt with all the underlying things, but cholesterol levels are still high. Then I think statins are really useful. But purely using statins to bring cholesterol down does not actually prevent any heart incidents. You have to really look at, very importantly, underneath why the body's driving that cholesterol up. So unless there is a familial hypercholesteremia, which is a genetic condition, statins aren't always the best way of treating this.
And if I could bring just one key concept across in my presentation today, is that the vascular system is not isolated. Our medicine has created a very reductionist approach whereby we separate body systems, cardiology, gastroenterology, immunology. But what's really important is that vascular health is the result of a complete ecosystem. And I want you to think about blood vessels as being a broader indicator of health. Later on, when we talk about carotid scanning, we will look at the blood vessels' health. We actually see the culmination of so many factors impacting on those blood vessels. And of course, as blood vessels feed all the body systems, any damage in these vessels will translate into damage in all organ systems. So often people will say to me, I have a family history of cardiovascular issues, or I've had a SIBT scan showing that I've got thickening. What's the supplement that I should take, or what's the one thing that I should do? There are so many contributing factors, and figuring out what's underlying at the root, the root for you is essential, so that you know where to put your focus, and you're not just randomly trying so many different things. It's knowing where to put your focus and energy.
So I think one of the most important concepts that I'd like to really bring across in this talk today is that the vascular system is an entire ecosystem, and it relies on so many different body systems. For instance, there's really useful research that shows that changes in our gut microbiome can impact on the health of our blood vessels. Inflammation, which can be generated in different organs or different tissues, can impact on our vascular system. Stress can have an impact. So, it's not just one system in isolation. So many body factors can have an impact on it. And it's one of the reasons why the vascular system is kind of like a very sensitive canary, I would say, in the coal mine of looking at overall organ health.
So cardiovascular disease needs to be looked at in a much more complex way than just looking at your cholesterol levels, for instance. There's never a straightforward factor at play. Often you'll find a combination of bad cholesterol, inflammation, blood pressure, metabolic syndrome, all kind of culminating together. In fact, inflammatory markers are better predictors of cardiovascular disease than cholesterol. So the formula for developing cardiovascular disease looks something like this. Genetics plus your environmental factors plus lifestyle choices will be leading to metabolic changes that leads to cardiovascular disease. In other words, even if you have cardiovascular disease in your family or genetics, it takes a combination of environmental and lifestyle factors to trigger those metabolic changes in the body that will lead to disease. Now you throw in some inflammation and you set up a perfect storm. So this is an image I want you to keep in your mind as we go through this presentation. As we age, our blood vessels do become a little thicker. You can see a normal artery on the left-hand side. But every time there's a little bit of damage to the lining of this artery, you'll find that the immune system comes in to heal it and repair it. And very often it also will lock in a little bit of cholesterol in that process so that you end up with a buildup of cholesterol and some white blood cells and immune products, all kind of, you know, building this little layer inside. And that layer can be stable. In other words, it's a formation of some plaque inside that's not easily going to rupture, or it can become quite fragile, where some of this plaque that's built up can rupture, leading to things like blood clots. So this is a really important image to keep in mind, because there's so many variables that will drive up this buildup of kind of debris and plaque inside the blood vessels. Um, and it isn't just cholesterol. So a number of things that's going to be having an impact. So the sheer effect of blood pressure, if there's more pressure going through these blood vessels. Or if you have what's called leaky blood vessels, whereby the lining isn't properly maintained by your repair mechanisms within the cells. Or if there's an inflammatory process going on and more of these immune products build up. So cholesterol isn't ever the only problem. It is more that the cholesterol gets laid down when that environment is not healthy. I really love this slide. This is a matrix put together by the Institute of Functional Medicine. What you see here are the kind of things that really contribute to this whole ecosystem of cardiovascular health or disease. So we look at things like, antecedents. These are things like, for instance, your family genetics, whether you've been smoking. There's a gender bias as well. And also look at things like triggers. Stress can be a big trigger, infection, dysbiosis. Then we talk about mediators and perpetuators. And these are the things that keep a disease process going. So for instance, insulin or inflammation. But look at the center of this graph. Things like low testosterone, or even moving into menopause changes your vascular system. We look at things like kidney disease, high levels of homocysteine, constipation. These are all things that we know can impact on blood vessel disease and heart health as well. What I really like is at the bottom, these are your modifiable personal lifestyle factors. And this is where patients can really get into looking at the things that they can in some ways control. So sleep quality, exercise and movement, nutrition, stress, and one that's really important for the heart is relationships. So we're all aware that foods that are high in fats and high in sugar drive up our risk for cardiovascular disease. But what is interesting is it's not just those kind of fats that make their way into the bloodstream and clog the arteries, although that is an element. It's actually the impact that it has on our gut microbiome. So the food that we eat tend to feed the bacteria in our gut, and different foods feed different types of bacteria. So the higher the diet is in processed fats and high in sugar, we tend to feed bad gut bacteria, which then create some damage to the lining of the gut. We then have things like lipopolysaccharides escaping from the gut into the bloodstream, which creates inflammation. And it's really that inflammation that starts that process of damaging that blood vessel lining so that the cholesterol can then stick. So when you think of foods, I want you to think not just about, are these fats going to go, or these sugars going to go in and actually clog the vessels. I want you to think about feeding your gut microbiome and the impact that has on inflammation and the impact that inflammation then has on your blood vessels. So it's really important to identify and address upstream factors, because there are lots of different things that are going to be impacting on heart and vascular health. Genetics we know, but we also know that you can do something about it if you have that family genetics. Lifestyle choices, your blood pressure, your fat levels, glucose, your BMI, inflammation, so many important things. But insulin is an important one because it's the catalyst for cardiovascular disease in so many cases, and yet it's very rarely tested. So an increase in the hormone insulin can drive up blood pressure, it can drive up cholesterol, it can trigger clotting, and markedly worsen the outcomes of cardiovascular disease. So you can see why insulin is going to be one of the most important things that you test on that panel. And for people with high insulin, lifestyle changes are extremely powerful in reducing the metabolic drivers of cardiovascular disease. Some of the key areas that will increase your risk of developing vascular disease. So these are kind of, we've broken them up into these key areas. For instance, could you have a problem with insulin? So you might have a high fasting glucose, or your HbA1c is on the higher side, or you have a raised insulin level if that's been tested. Your liver panels, your gamma GT, your ALT might be raised, or triglyceride levels are often an indicator that insulin might be a problem for you. So lipids, I think most of us are aware that, raised cholesterol puts you at higher risk. What people aren't always aware of is that if your thyroid function is sluggish, your cholesterol levels naturally go up as well. So could it be that you need to address your thyroid? And then vascular system, we're talking about things like high blood pressure or things like edema, which is really important to look at. And here you can look at pulse rate, oxygen, blood oxygen levels. There are lots of markers in terms of vascular. Also, that carotid scanning that we've spoken about can be a really good indicator of what's happening at this level. Or autonomic nervous system, stress and stress tolerance, or your cortisol levels high. Coagulation, you may have in your blood a high erythrocyte sedimentation rate, or a high MCV, homocysteine, high testosterone levels. And then immune and toxin. So a really interesting one here, you'll notice that gum disease is listed there, but there is quite a lot of research that gum disease can significantly increase the risk for cardiovascular incidents. It's a really, really important one. This has been, there's been research out there available for decades already. And we know that people with periodontal disease have 3 times the risk of having a heart attack. So it's really important to obviously, have your gum health checked quite recently, quite frequently, and make sure that that's well taken care of as well. Lifestyle is exceptionally important when it comes to vascular health. I think it's the one area we see lifestyle interventions having the biggest impact. So I think we're all aware that smoking massively damages our vascular system. But what are some of the other important areas to look at? So insulin is something we speak about quite a lot. But looking at your cholesterol testing, definitely look at a little bit more than just total cholesterol. Your apolipoproteins are often much better indicators. Or your LDL pattern. Is it small, dense LDL, which is more harmful than your large LDL? Has that LDL been oxidized? In your vascular system, looking at, blood pressure, for instance, does the blood pressure dip at night? Autonomic nervous system, we know that anxiety and depression actually are known to increase cardiovascular rates as well. So, there's so many different areas here to look at, and I would encourage you all to do a really thorough workup of a lot of these markers, especially if there's a genetic risk, or if you have had a carotid scan that's showing that there is some thickening. I encourage you to really dig in a little bit deeper and understand where to intervene. So, and then how do you treat what you find? So there are some really lovely, very focused protocols that you can use once you understand your kind of key areas. So just for instance, if your main risks are around autonomic nervous system, in other words, stress, things like biofeedback, breath work, meditation, yoga, supporting your adrenal glands. Or maybe your issues are around coagulation, tendency for blood clotting, in which case you'd be looking at bromelain or vitamin E, nattokinase, or nutrients like B6, B12, and your fatty acids. Or perhaps your issues are with insulin, in which case, have you got enough chromium? Berberine can be very, very helpful. Olive oil. And so, I think this is, again, very often people will ask me, I've had a SIMP scan which shows there's thickening. What's the one supplement that I should take or the one thing that I should do? It really depends. It depends why. Why are we seeing these changes for you? You have to dig in a little bit deeper. You have to understand why and where to go and intervene. Um, So the SIM test, the carotid intima media thickness test, is a very powerful diagnostic tool for looking at the inside of those blood vessels. And what makes it particularly valuable is that it's a very early warning system for cardiovascular health, because you can start to look at these arteries and see if you're getting a thickening of that wall and a build up there. Um, and this can often be picked up a long time before any of the other markers are showing. So, and it's also a great way of, to track whether what you're doing is actually having an impact. So with the SIM scans, we measure the lining thickness of that blood vessel, and then it gets mapped onto your age in years. There's differences in males and females. So for instance, if you're a 45-year-old female, your score should be sitting at about no more than 0.55 millimeters. And if your blood vessels are thickening a little bit more than that, it's a good indicator to start looking at some of these, really important interventions.
So your conventional risk factors like cholesterol and blood pressure are often just the tip of the iceberg. Underneath, there can be a big process going on. So I think, it's really important to look at things like inflammation. Markers like homocysteine as well are really, really critical. And really understand your true risk. And I think this is one area where functional medicine is really very, very good at, looking deeper underneath at what's going on. But I'm going to encourage you to think deeper than just simply blood pressure and cholesterol.
So we've been talking quite a bit about, the key markers that you should be looking at. This is a cardiometabolic profile that we run in clinic. There are some other labs doing similar things as well, but you'll see we're not just looking at total cholesterol, triglycerides, HDL, and LDL, which is your kind of classical ones. Also look at the very low density cholesterol, small dense LDL, which is, these are much better indicators of, what your cholesterol's like. Oxidized LDL, has that LDL become damaged? Lipoprotein A, which is a genetic driver. Apolipoproteins, which are way more sensitive than your total cholesterol. But you'll see also insulin, glucose, homocysteine. Homocysteine is a critical marker, really looking at the health of blood vessels in terms of inflammation. And we look at CRP, is there an inflammatory process? And then the PLAC, which is plaque activity. Is there a buildup of kind of plaque? So, just an example of what a really thorough cardiometabolic workup would look like. So we can see there's a shift towards lifestyle. The American Heart Association and American College of Cardiology have updated their guidelines. So previously, the guidelines were really about using statins just to reduce cholesterol, but the upguided guidelines are really enforcing the importance of healthy living and lifestyle modification and prevention rather than waiting for an incident and then trying to treat. And it's really nice to see these shifts coming on now. So I'm just going to touch on a few things today that can impact on this. Stress. I want to talk a little bit about how chronic stress influences our blood vessels. So we know that chronic stress alters our hormonal balance within the body, the production of things like cortisol, but also our nervous system function. And that, of course, has got quite a lot of uh, causing a lot of change in the body in terms of inflammation and blood clotting and blood pressure as well, and insulin resistance. All of these things then go on to have a bigger impact. So very often, it's not just about diet and supplements. Really looking at stress management is very, very important in cardiovascular disease.
So again, today I'm not going into detail. There's not enough time on this talk, but just touching on exercise and movement, there's a lot of evidence out there that sedentary lifestyles do lead to higher risks of cardiovascular disease and diabetes. So exercise and movement becomes really critical as well.
There's so much research out there on the Mediterranean style diet. Um, and I'll show you a study shortly, which just shows you the impact that this has. But the Mediterranean diet really refers to a collection of habits followed by countries bordering the Mediterranean Sea. Primarily involves high olive oil intake, lots of vegetables, legumes, whole grains, fruits, nuts, spices, and herbs. Moderate intake of fish and poultry, low red meat and dairy, and low to moderate alcohol intake. So you read that right. This study had over 4 million subjects. Um, and what they found was a 2-point increase in adherence. So, in other words, they put people on a Mediterranean diet and then really looked at their adherence. And those who adhered to the Mediterranean diet had an 8% reduction on overall mortality, 10% reduced risk of cardiovascular disease, and 4% reduction in cancer. And that was only what they called a 2-point increase in adherence, which means that people were only taking on board maybe one or two of these habits. So imagine if you really fully did this, the impact that would have. Sulforaphane. So this is a sulfur compound that's found in cruciferous vegetables like broccoli, broccoli sprouts, cabbage, Brussels sprouts. Some really interesting research that's come around about that, showing that it's a very powerful antioxidant and anti-inflammatory. And so it's shown to reduce total cholesterol, leptin, and then triglycerides, which are one of the bad cholesterol levels. So the Cardiometabolic Food Plan is one that's been developed by the Institute of Functional Medicine. And it's a plan that's low in glycemic index because we spoke about the effect of insulin on the cardiovascular system. It's anti-inflammatory. It's got a lot of phytonutrients in to stabilize blood sugar, reduce that insulin, and prevent inflammation. This is a very well researched diet that's been, I think, researched over several decades. So this is an interesting study looking at the effects of nuts on lipoproteins, and what they found was a combination of nuts and olive oil actually improved good cholesterol significantly and reduced some of the bad cholesterol levels. Green tea has been shown to have a really good impact on not so much on reducing cholesterol levels as such, but in preventing what we call oxidative stress from those lipids. So, which is another element that can be adding to that plaque formation, and also a really good, powerful antioxidant. Omega-3s, these are found in fish. So what we see is the higher your omega-3 levels are, the lower your risk for sudden cardiac death. So really good reasons for getting in cold water fish or taking a very good quality omega supplement as well. Food and antioxidants. So there are certain foods like um, with really powerful active components in tomatoes. I've got lycopene, a lot of your green leafy veg, and have got carotenoids in. The right oils, citrus fruits and veg we know has got vitamin C. So there's a lot of foods that have got very active components in that we know can play an important role.
So endothelial function, which is something we talk about quite a lot on these slides, is that inner lining of the blood vessels. The foods that are really helpful in keeping those linings looking really healthy so that they don't get inflamed. Your omega-3s, which you're going to see come up quite a lot in other recommendations, but polyphenols, anthocyanins, flavonoids, so really all your very powerful antioxidants. So looking here at things like dark chocolate, grapes, high levels of fruit and vegetables.
Pomegranate is a really interesting one. We sometimes see really good results with this. Not all high blood pressure is going to respond to this, but there are for some people they can bring blood pressure down with some natural interventions, and pomegranate is one of them. It's very rich in tannins, and it supports that internal vascular lining. So interesting study where people were given 330 milligrams a day of pomegranate juice had quite a significant drop in their blood pressure. So, it is worth experimenting with all of these things. And I always think if you can do things naturally before you start reaching for medication, that's always the best way. Medications should be left as a last resort when you're unable to bring down blood pressure in any other way. One thing we haven't really spoken about today was the LDL oxidation. So LDL is what's termed bad cholesterol. The problem with LDL isn't always how much of it there is. The problem is when it becomes oxidized. So think of fats when they're exposed to oxygen, they become rancid. So it's that rancidity of this LDL that ends up causing damage. So what we can do is these bioactives don't necessarily bring down the level of LDL so much, but they do reduce the oxidized LDL. And this is also something you can test in your lab panels, how much of your LDL has actually been damaged or oxidized. There's some really lovely things in here, pomegranates and dark chocolate and green tea, extra virgin olive oil, which is a big feature in the Mediterranean diet. And again, omega-3 fatty acids. So if you've been told that your triglycerides are high, these are the sticky cholesterol units. We know that omega-3 fatty acids from fish and sulforaphane, which is in cruciferous vegetables, have got some really good evidence for bringing down triglycerides. Having said that, we tend to find as your insulin levels go up, your triglycerides are also going up. So managing insulin becomes really important when triglyceride levels are high. So homocysteine, that's that marker we spoke about that is an indicator of vascular damage and also potentially the an early indicator for the development of dementia. Um, and some active things that we know will improve the blood markers. Folate is one of the most important ones, but vitamin C and vitamin E also play a role. So in terms of homocysteine, you probably want to put your focus onto folate. There have been so many studies on olive oil. It's crazy, but I think that's probably one of the big parts of why the Mediterranean diet does have such good effects on cardiovascular health. Olive oil significantly improved that endothelial function, so that lining of the blood vessels that we were talking about, and reduced inflammation. So all those inflammatory markers that we saw that build up inside those blood vessels, and an interesting response on platelets. So it has the ability to prevent kind of sticking of platelets and blood clotting. So olive oil has to be a really good quality olive oil. There's so much research on using this. You know, I encourage people to drizzle this onto their food and to have at least a couple of tablespoons of really good quality olive oil every day. So the Institute of Functional Medicine has put together the Cardiometabolic Food Plan based on decades of research. It is one of the most researched food plans out there. With we've got studies of over 4 million people with, on a modified Mediterranean approach. But this gets a little bit more specific. It really will focus on low glycemic impact, getting the right quality of fats in there. And then very condition-specific phytonutrients, as we looked at on the previous slides. What do you do if your LDL is high or if your insulin's high? What kind of things you can put in. So you'll all have access to this cardiometabolic food plan. I encourage you to download it, personalize it a little bit based on your labs, and look at incorporating more of these foods in. So the food plan is not so much about restricting foods, it's more about including certain foods that contain elements that we know can have an impact on the body biochemistry. So we are very excited to announce our 6 weeks Healthy Heart program. It's a very research-based program which primarily looks at lifestyle choices, nutrition, exercise, sleep. But what makes it unique is that we get everyone before they start the program to run a blood panel. We will spend some time during the 6 weeks learning about how to interpret these results and look at, sort of personalizing it for each person. As part of the program, we also do heart rate variability testing, carotid ultrasound testing, and these are all fantastic ways that you can track and monitor things over time. So typically how the program would look is that the person would come in for a blood draw. We would do ultrasound, we would look at heart rate variability, and also their kind of personal biomarker levels. And then there's a 6-week course where we delve into, how you work with these labs, where you need to put your energy and attention. We look at the research and science on things that actually do work. And then afterwards, encourage people to retest again some of maybe the blood markers that may have been out of range to track their progress. So a very exciting program. And get in contact if you are interested in joining us. So I'm going to encourage everyone who's over the age of 40 to go and get checked, see what your numbers are like. And then if you do find that there are areas that are out of range, work with a good functional medicine practitioner, but be specific. Go in and understand why your vascular system is aging a little quicker than it should be, or just simply inform yourself and get as much information as you can, because lifestyle hugely impacts on our vascular health, and what you nurture grows. So where you're going to put your attention and energy is going to be having an impact for the next 20, 30 years. And I encourage you all to think about yourself, would your future self, 20, 30 years from now, thank you for all the changes that you've made at this stage in your life? Well, thank you for joining me on this talk.